Good morning and welcome to Super Healthy Super Morning with Dr. Shilpi. Today, this is one of my favorite topic, and it's all about having natural delivery. It's all about having a normal delivery outcome, and it's all about encouraging normalcy in pregnancy and a very happy pregnancy and a very memorable one. Uh, and having a normal delivery is everybody's dream. And people have a lot of apprehensions about it. But then, why normal delivery is called a normal delivery? Because it does not have, the associated high risk factors compared to an operative delivery. And for a mother, it's a bliss to go through normal labor and give childbirth, and the experience itself is quite unique. But whenever you want to have a normal delivery, you have to be highly motivated. Your partner should be supporting you, super supportive family, and you should have the determination to go ahead, so whatsoever may be. So that's one thing. And as we talk about normal delivery, natural birthing, one of the methods of normal delivery and a natural birthing process is water birthing. People have lots of apprehensions about it, lots of questions about it. We're going to talk everything about water birthing today. And one thing I want to tell you is water birthing, it's a very natural process, and there is nothing that you should artificially add to it unless and until it is required. And you need to be very calm, very relaxed, and you should not have any disturbances. A very good supportive partner. There's a high role of partner in water birthing, and you should be comfortable with the water, you should be comfortable with the wetness, you should be comfortable with the entire process of labor, pain, and you should be highly motivated. And once the labor process starts, you can't be restless, and you can't expect it to complete in a set time. Or it's not about mathematics, it's about science, and science is about variability, and two people do not deliver at the same time. Anywhere you compare, it doesn't happen like that. And there is no role of comparisons. There is no role of nowadays what women have. They are very restless about things, and they want everything to happen instantaneously, and they want everything to be under control. See, labor process is never like that, and it has its own track. It has its own time taking thing. And the more your supra brain works, the subconscious brain or the brain above level of the brain works, it creates blocks, and once blocks are created, your labor doesn't progress. So it's very important. You should be calm, relaxed, no disturbances, good partner support. You should be comfortable with water and the atmosphere, and you can arrange whatever music that you want to. You can arrange your aromatherapy, you can arrange your candles, or what kind of a temperature that you want, everything. And you should be in comfortable clothing if you want to. There are people who go for natural birthing even without clothes, but that is their personal choice. But comfortable clothing are important because you're in contact with water and for such long time. And the temperature of water is very important. We usually keep the temperature of water between 36.5 to 37 degrees, and we keep checking the temperature and making the adjustments so that it does not go away and cause low temperatures in the mother and low temperatures to the baby. And when the baby is delivering, the temperature should be approximately 37.5 degrees Celsius, and there is a person who constantly checks that so that the water temperature is maintained. And I will tell you first the rules. The rules of water birthing are, you should be somewhere between 37 to 42 weeks of pregnancy. You shouldn't be less than 100 kgs, and the baby's position should be head down, and it should be a healthy mother. It means that you should not have chronic health issues like hypertension, diabetes, severe anemias, and you should not have any history of epilepsy. You should not have any high risk pregnancy history, and you should not be on any medications as such to accelerate or promote labor, and you should not have any disorders, known metabolic disorders. You not known any of the obstetric complications, and since this process is without medications, you should be okay to go ahead with this. Sometimes if they are more restless, we can give you an Entonox gas for pain relief, and we usually do heartbeat monitoring of the baby inside the water also, but in the first stage of labor every 15 minutes or so, and when the second stage comes in, little more frequency we monitor, and there should be a lot more of compliance. Okay, you cannot throw tantrums in water birthing. You should be composed, and you should be in sync with what you are determined for, and it is very important. Your compliance should be very good, and whenever the sister or the doctor says no, this is not going well, you should be able to come out and deliver by other methods. And one very important thing is, you should not be having any infections like diarrhea and all that. So these are some of the basic rules. And now, as I have told you the 5 benefits of water birthing, you have to know what those 5 benefits are. And when it comes to 5 benefits, first is revolving around the pain factor. And people are highly motivated, and they are so much determined that the process itself, once it settles inside your brain, it does not give scope for more pain during labor. And in water, the contractions are also less painful, and so much of endorphins are released that with warm water, the endorphins that the body releases, it itself curtails some kind of pain and gives pain relief. And there is very less intervention in terms of giving pain relief medications or analgesia. Maximum, if they are saying that we're not very comfortable, then you can give some Entonox gas, and there is no role of epidurals, there is no role of any other interventions for pain relief. And that is one thing, that in water your body feels light, you feel a little more relaxed. That is very, very important, and that's the first thing. Now the second thing that comes is, there is a very low need for drugs, especially the drugs that we give to accelerate labor or shorten labor, or per se. In water, the body itself has a mechanism to conserve energy and promote labor. So when in water you feel lighter, and the body itself feels so much light that the energy that is required to go through labor and delivery is conserved, and that itself promotes more labor process to go ahead. And the need for external medications, the need for taking other supportive medications is absolutely not there in natural birthing. So that itself says that if you are very well motivated, only you can go for water birthing. And the third thing is, it's a very enjoyable experience, and it's natural birth that you can achieve, and you have your own a mode or a method of delivering through water birthing. Even your partner is along with you, and there are different positions that you can try during labor and delivery, even in water. And it's an enjoyable experience. The third one is it's an enjoyable experience. It's a memorable experience. Even thinking about the painful aspect of labor and delivery, you can cut down on that and make it memorable with things like water birthing. And the fourth advantage is the pelvic floor muscles. The pelvic floor muscles are the ones which are necessary during labor and delivery. And in water birthing, there is absolute, a better relaxation of pelvic floor muscles and the perineum, the tissue around the, outlet of the vagina, and the tissues in between the anal canal and the vaginal canal, which is called the perineum. The perineum is very soft, and there is a little lesser risk for having lacerations or tears or any other very less interventions like cutting, the process of cutting the perineum called episiotomy, or all these things are little lesser, not absolutely less, but a little lesser in incidence. And when it comes to birthing, it is little more gentle birthing that happens to the baby. And water itself gives so much of relaxation on the pelvic floor and the perineal area. It is very ideal, and it is not hard and it is not stiff, so it gives way for the baby delivery much better than the normal delivery. And the fifth important thing is, immediately after the baby delivers, you can have contact with the baby. You are the ones who are taking the baby out, and you are going to put the baby on yourself, and you can encourage immediate skin to skin contact, and you can encourage breastfeeding. You and your partner can have those blissful moments. There is no there is no intervention of a doctor or handing over the baby to the nurse or the pediatrician. It is at that time that you yourself are delivering the baby and keeping the baby in touch with the mother's skin. So skin to skin contact is very soon, and all these things make those moments of happiness a little more blissful. So in water birthing, there are so many benefits. As there are benefits, there are definitely there are certain risks. When it comes to risk factors, we should be discussing about those things also. And in such risk factors, there is one risk factor that is about the process. And when the baby delivers underwater, if the baby starts breathing underwater, then the chances of water aspirating into the baby will be there. But when you keep the temperature of the water correct, and and you keep monitoring the delivery happening, once the baby delivers, if the temperature is around 37.5, well maintained, and you immediately pick up the baby does not do this breathing process, and it usually prevents. So it's very important that baby breathing underwater can cause aspiration, and it is the one thing that you need to really look into. And you need to keep monitoring the temperature of water very closely. And there are at times people are restless, and they usually break the sink and they come out of the pool and deliver outside on the land. So that is one thing that usually happens because of less motivation, or they do not have that much of patience, and they are not okay with what is happening in terms of pain relief. They usually come out. So that is another thing that can happen. And placental delivery also at times, though it happens earlier than what it happens outside the water birthing thing, but it can be little cumbersome. It can be a little problematic if it is inside water. So that is another risk factor. And the amount of blood loss cannot be visualized that easily. And in water, usually we will not be able to track what is happening, especially in terms of blood loss and the placental separation and all that. And very rarely, say about 3 to 4 or 3.1 to cases in 1000 cases, there is snapping of umbilical cord. That is a tearing of the umbilical cord that happens in the water birthing. So that's another accident that usually doesn't happen. But yes, the incidence is about 3.1 cases per 1000 natural birthing in water or water birthing cases. Umbilical snapping is an accident, and Once the umbilicus gets detached, there is blood loss. So it is important that you need to be very watchful about these things. And you know, usually everything is very comfortable inside the pool, and the pregnant woman comes out of the pool and into the pool only for the purpose of going to the toilet, or if the heartbeat is not very clear, you need to come out and check the heartbeat and again go back. And if there is a vaginal examination needed, or if we have doubt that the process is not going softly or as per schedule, you need to have a proper examination. She needs to come out of the pool at times, because even inside the pool there is a vaginal examination possible, but outside the pool the other factors can also be clearly checked. And if her blood pressure or if her pulse rate of the baby or the baby's heart rate is not correct, then she needs to come out of the pool. And you know, if there is no progress of labor, she needs to come out of the pool. And at times, once the baby is delivered and the skin to skin contact has happened and the baby is with the mother, at times she needs to come out if the placenta is not coming out on time. And you have to, whenever you want, you can come out of the pool by your choice, because the choice of delivering in water is your own choice as per the motivated parents. And if they are not willing to deliver in the pool, they can come out at any given point of time, but not at the time of baby delivery, because it can lead to accidents. So if it is exactly at the time of delivery, you need to be in the same position where you are. And there are several advantages of water birthing. The Cochrane, the highest authority in the European Union, where they do lots of research, which is called the Cochrane Review. It also has revealed its research with water birthing. It says that the need of painkillers or the need of interventions in terms of pain management are lesser when it is with water birthing. And there are so many studies that have said that there are no additional risk factors associated with water birthing. And all that is important is you have to be motivated. The partners or the parents have to be motivated, and they should have the determination to go ahead. Motivation is something that is really working in many ways, and highly motivated people do have a faster labor whatsoever method they choose. But even in water birthing, that is a thing that happens, and there are lesser chances of conversion to cesarean, lesser chances of having a meconium, that is the passage of motion of the baby, the lesser chances of abnormal heart and breathing patterns in children. So it is very important that this process should have a clear perspective, and the take-home message should be clear. So it's one of the methods of delivering with safety, according to not only as the process says, it's natural birthing in water, which is water birthing. Even the statistics also say the same thing. And if we have to talk about its further advantages, it's natural birthing in water. There is lesser need of any cuts or incisions, but there are tears that happen which we need to repair. And compared to the other pregnancies, this category of water birthing cannot be applied to all pregnancies. So all high risk pregnancies are one side, and the low risk pregnancies who opt for water birthing are the other side. We cannot compare both the statistics in any way. So even in people with water birthing, and even with people with similar risk factors of normal birthing, they have different aspects that we can compare, leaving alone the high risk people. So there are lesser chances of tears, there are lesser chances of pain relief medications, and the length of labor is shorter, and the blood loss is lesser, and you can deliver in the upright position, and no hands hands-off delivery, and there is a lot of maternal satisfaction because it's a motivated choice, and the pelvic floor function is also established similarly like what we do in terms of natural delivery, normal delivery, and lesser chances of maternal delivery to the hospital or an emergency, because she is definitely a low risk a woman with no other medical conditions associated, and lesser chances of maternal infections is also noted. And advantages on the baby side also, we need to note that newborn health wise, we calculate a score called APGAR score, which is based on the respiratory movements, the contraction of the limbs, and breathing and heart rate and skin color and all that. Those scores are better in water birthing, and there are nothing extra in terms of breathing difficulties. The umbilical cord blood flows are also better in water birthing, and the incidence of shoulder getting jammed off after the baby delivery is also the same, and newborn infections are not increased when you deliver in water. There is no such evidence like you will have this infection or that infection when you deliver in water, and NICU admissions are not more, and most the important thing is you do not when you are delivering in such low risk conditions in the mother, there are no additional risk factors to the baby as such, other than the small risk factors like umbilical cord tears which you need to look for and manage, and there is no such absolute need for some interventions for the baby, and you have to watch for the temperature of the water that the baby is delivering to avoid hypothermia. That means the temperature lowering effect in the baby. So these are certain things that really are important in terms of water birthing and what you should know about water birthing. And there are several places that give water birthing as a choice, and there is purely selection of patient from the doctor side. Even if one wants natural birthing and water birthing, if you do not fall under the criteria that fits to water birthing, you cannot be going through water birthing, because nowadays there are so many women with diabetes in pregnancy, hypertension in pregnancy, blood flow abnormalities in the babies, obesity. These are some of the risk factors that automatically cut you off from this choice. So that is why we say it should be a healthy pregnancy and it should be a motivated pregnancy. And the more you go towards putting an effort in such things, it really is helpful. And once you start attending your prenatal classes, once you and your partner are motivated, you eat right, eat seasonal, eat what is available in the local markets, eat and live sustainably, you would not have any of the high risk factors stepping into your pregnancy to stop you from going with water birthing. And water birthing is something that is a choice, and even I do a lot of water birthing cases, and it's completely different. And whenever there are high risk pregnancies and the baby's weight is crossing, there is a different type of birthing concept that I have, so that they deliver naturally. For somebody who wants water birthing, then definitely the choice is accepted once they fit into these rules. And there are different categories. I mean, there are places where there are water birthing pools established. There are places where they do water birthing in makeshift pools, especially when it is home birthing. In home birthing, you have a makeshift pool, which is an inflatable pool that you use for water birthing. Such pools are much better because disinfection of such pools is easier rather than any built-in jacuzzi or any alternative setup. if you want to have water birthing, those makeshift pools are much more comfortable. And in hospital setups, we have a separate entity, and how to sterilize those pools and all is practically possible. In home setups, you have makeshift pools. There are people who deliver in their bathtubs also, but in terms of space, it is not that very convenient. But there are there are at times such things happening, and there are people who are very well trained in water birthing to support this entire process happening. The doctor steps in whenever there is need of the doctor to come in and to check if check and reassure things. So that's very important. And it's a beautiful concept, and it's the way you want to choose your life. And this is all about water birthing, and it's available since 1805. So imagine 200 years of history water birthing has. And there are countries that promote water birthing. There are countries that give services for water birthing at your home also. So that is again the choice that they give to their pregnant women. And in UK, it is a choice that you can make. And in USA, there are controversies, but yes, there are people who have doulas, who have midwives, who do these kind of things in low risk settings. These days now, in India, we have so many pregnant women in the high risk category that we are not able to give them this option that easily. But yes, for every low risk pregnancy, they can definitely opt for water birthing, and this is one of the methods of choice if you want to. And yes, we have water birthing facility at KIMS. The charges of water birthing are little different, but we have water birthing at KIMS, and it is usually not covered in insurance. So it has to be noted that water birthing has a different kind of a billing, and it has a different kind of setup that is needed. Insurances do not cover water birthing for whatsoever reasons they have, and it is there at KIMS. And we have an entire system of people who are who are very well trained. There's Pratima, there's Shija sister. They are very well trained, and they've been doing water birthing since almost 8 years now. Yes, 8 years now. 5 years in KIMS, and before that also they were doing water birthing. And it's a beautiful experience that you should really think. But you have to put in a lot of effort, and you have to get your pregnancy into the normal category first, even to qualify for water birthing. So that's all about water birthing, and we take this series of live shows to encourage natural delivery, natural birthing, and to educate people about these things, and to empower women and pregnant couples to go through normalcy in pregnancy and delivery. So this is all about today, and we'll catch you tomorrow with yet another beautiful topic. And stay tuned, and just figure out to be and have a sustainable living. Thank you, and see you all tomorrow morning.